Uncompensated care is once again on the rise in Wisconsin. We're talking about the amount of bad debt and charity care that hospitals are reporting in the fiscal year of 2017. And for the first time since 2014, that number is back over $1.1 billion. That's an increase of over $142 million just over 2016, the prior year. This is data that is coming to us out of the Uncompensated Healthcare Report for Wisconsin Hospitals, fiscal year 2017, from the Wisconsin Hospital Association Information Center. Nationally, that number is up over $38 billion, but that $1.1 billion number for Wisconsin is startling. You can see the trend for yourself. Look at 2016, which is the first dot we have on our chart. That was when the marketplace opened for the first time. People had access to healthcare coverage in new ways for the first time through 2013 and 2014. Not just the Affordable Care Act, but through the pseudo Medicaid expansion in Wisconsin, where adults that did not have children in the home could join Badger Care Plus for the first time. Well, then that trend reverses. Some folks, advocates, health policy experts, are pointing toward the political sabotage of the ACA as some of the reasons behind this turn in uncompensated care. Segmented insurance markets are exacerbating healthcare costs, and you're now seeing more people with bad debt, unpaid medical bills, and not a coverage source to connect those. Therefore, the rise in uncompensated care. And there's also the bureaucratic and administrative hurdles, ever-changing program rules, red tape, surprise medical bills that are impacting healthcare costs as well. As a result, these healthcare coverage barriers increase medical debts for patients and uncompensated care for providers. The overall impact, as you can imagine, is bad financial performance and customer relations for the hospitals, but real pocketbook pain for patients, especially those patients that are impacted by health disparities. Patients are often eligible for a health coverage program, but just aren't connected. So the onus is now on the providers to try to make it easier for their patients to connect to the coverage sources that are available, despite all of the moving forces out there, the political talk, the ideology, and the changes in rules and administration that might make it hard for people to actually connect to the benefits they're entitled to. And of course, uncompensated care gets spread to everybody. When patients in a hospital can't afford their medical bills, that cost gets redistributed to all patients and everybody's bill goes up. Some active solutions: work towards reducing uncompensated care. Create programs and policies to create seamless administration of care, to make sure it is easier for patients to get to those payment sources for the care that they're receiving. And focus more on just the cost of insurance, actually address the fundamental issues of healthcare itself. And that's a long-term conversation, not a short-term one. And finally, keep in mind the consumer assistance and protections that are necessary to make sure patients can get to the care they need and deserve. You can read that new Uncompensated Healthcare Report from the Wisconsin Hospital Administration. You could also read a fact sheet that talks about that $38 billion nationwide in uncompensated care. And we also have talked on this a little bit ourselves with a press release, and you can read that on our website. You can also share your healthcare story, talk about medical bills, or ask us a question, and you can do that at healthwatchwisconsin.org.